Hi everyone, thank you so much for being with us this morning. And yeah, as stated, we're going to be talking about a super crucial topic today, and that's the human right to a healthy life. So first of all, my name is Sohayla Eldeeb, and I am a healthcare sustainability fellow, but more importantly, I am actually a youth activist. I've been a part of the youth climate movement for about 9 years, and it started super simple. I grew up in Egypt, and I was able to witness firsthand the Nile River right in front of my grandmother's home being polluted day and night. Things that I thought were normal, people like washing their dishes in the river, like bathing, just swimming, over time became detrimental to people's health. And it was just simply right there before my eyes. And I think it's something that's crucial to talk about because it impacts every single person in this room. And that's our human right to a healthy life. So with that, I'm going to be speaking about a couple of things, just introducing the connection about climate and health. And I'm sure you're going to be hearing about it way more from like super cool and experienced speakers. And then I'm going to talk a little bit about something that is super shocking, and that's how the healthcare systems actually play a huge role in the emissions that are being emitted every single day. And then a quick case study that we've done at Stanford. And then, yeah, and leave you with some key takeaways. So what connects climate and health? I think I get this question a lot, maybe less so in spaces like this one, but definitely from my friends. They said we've never heard that there was a connection between climate and health. And to that I say there are many, many ways that they're connected, and here are just some instances where we can directly correlate the outcomes. Environmental degradation leads to forced migration, displacement. We're seeing it right now with world conflicts. Severe weather leads to mental health impacts, and there's actually cool speakers that I saw that are going to be speaking directly about this. Air pollution, asthma rates, I'm going to talk a little bit about that in a few, but as you see on the screen, there are just so many ways, and I think this has always been on the sidelines when it comes to the climate conversation. In what way? In that people view it as kind of like a side project that's going to happen when we cut down on climate emissions, but I think this should be on the face front of when we talk about the climate crisis, and that's because it's already impacting people today. People are already facing higher asthma rates based on where they live. People are already facing severe dehydration in drought spaces in the global south. People are already facing displacement because of migration and environmental degradation. So I think when we lead the climate conversation, we should lead it with health in mind because we are already seeing the impacts. So, like I said, we're seeing the impacts, but we're also seeing the same populations being hurt. We don't have to look far. We can just look at the COVID-19 pandemic. We saw lower socioeconomic populations being hurt. We saw elderly people being hurt. We saw people that were already hospitalized and chronically ill facing the most impact. And those happen to be the same vulnerable populations that are being impacted by the climate crisis. So again, that's why I said we don't have to look far. We've already seen what it does on a global pandemic scale, and that's exactly what's already happening and will continue to happen due to the climate crisis. So yeah, and I also want to pinpoint young people specifically, and on the next slide, I talk a little bit about that. So the time we're in is crucial. Nature actually did a study with young people about the climate anxiety that they face, and about 60% of them said they feel worried or extremely worried because they feel that this climate crisis is basically a looming threat for their futures and even today. And I'm sure this is a super common feeling that we all must have since you guys are here already wanting to listen about the connection between climate and health. So I'm sure this is already on the top of your minds. And I do want to validate that because the Lancet itself, which is a huge scientific journal, said that the climate crisis is probably the greatest threat that we're facing currently to global health. So I don't think that's something that we should take lightly, and I think we need to branch out from feeling this anxiety and shift it towards who to blame, but also who to push for action. And I want to talk a little bit more about young people. On the next slide, we talk about young people on the front line. I just want to paint a picture before we talk about why this is important. There's 1.12 billion young people between the ages of 15 and 24. So that's about 16% of the current population. So imagine that most of these people are facing this climate anxiety currently, and in the future, they're going to have to face the threat that's looming for their future. And children and young people under the age of 35 make up 50% of the world population. So according to our World in Data, the global average median age was 30 years in 2021, and half of those people were older than 30 years and half of them were younger. So again, I want to pinpoint that a lot of us in the room, are facing this issue, and we're not taking it lightly, because not only is it our future at hand, but it's also people that are younger than us and older than us that are facing these impacts. So yeah, I want to talk a little bit about emission scopes. These are probably super familiar to you because a lot of people have been talking about where these greenhouse gases are being emitted from. A lot of them we partake in every day: transportation systems, supply and energy related items, buying something off of like shopping online, business travel. Most of us actually travel to get here. So we're really familiar with these emissions. I don't have to really dive into them that much, but the next slide is what's super shocking. And that's the healthcare's climate footprint. I find it super, like a huge example of paradox. A system that is supposed to ensure the quality of health and ensure that they're ensuring quality patient care is also contributing to an issue that's being detrimental to people's health. And that's because the healthcare sector actually contributes a huge amount of greenhouse gas emissions to our everyday life. And I think that to me was extremely shocking when I saw that the United States, for example, where I'm from, actually emits 16.5% of the footprint per capita. And it's not something to be taken lightly. I think I actually saw a recent study that if the healthcare system of the entire world was actually counted for as a country itself, it would be among the top 10 emitters in the world. So imagine, we have all of these hundreds of countries, healthcare systems alone are in the top 10 emitters of greenhouse gases. And I think that's crazy because these emissions are not to be taken lightly. And right here, I have them broken down into categories about where these emissions are coming from. We have scope 1, essentially transportation of healthcare systems is a huge deal, but more importantly, operational emissions. So I'll give you an example: surgery rooms where a surgeon is going into a patient. They of course have like a PPE requirement that they are required to follow. And in that PPE procedure, there is a bunch of supplies that are being cut open for the first time for the patient. And they'll use one of them. But unfortunately, all of them have to be thrown out, of course, for safety and health issues. But that is something not to be considered lightly. Along with other factors right here, we have technology systems being a huge part, and transportation. And I think the COVID-19 pandemic, of course, brought us a bunch of horrible things and impacted a lot of people, but it also showed us that there is potential to move onto telemedicine, or basically offering patient care through a virtual appointment for quality patient care that is possible to do online. For example, I actually ran a study at Stanford where we're offering like telemedicine for tobacco treatments. So people who are addicted to either tobacco or have like lung cancer can actually take their sessions online. And that not only reduced the greenhouse gas emissions associated with the transportation, but it actually also improved accessibility. A lot of people were traveling insane miles to come, because Stanford's actually based in California, and California is very long. People travel huge distances, and this actually helped them make their appointments and see better outcomes in the end. So COVID-19 showed us that it's possible because it forced us to do so. And now the question is, where do we go from here? So on the next slide, I talk a little bit about where we can go from here, and that's assessing and communicating the environmental impacts of patient services. And on the, sorry, I don't know which side it's on, but like on the screen here, we have the absolute greenhouse gas emissions. And right here it says the US health sector alone. Previously I said all of the health systems, but the US health sector alone would tank 13th in the world for greenhouse gas emissions. So I think when I saw that, I was actually just completely shocked, because I thought hospitals as healthcare providers have this responsibility to prioritize sustainability practices and to mitigate their environmental impact. And I think it lies in their mission statement. When we go to a hospital, when you look on their website, it says that they owe it to the people to talk a little bit about quality patient care and to also ensure that they are ensuring their health. So we need to make sure that this is part of the conversation. So I'm going to quickly talk about a case study that we've actually done at Stanford. In Stockton, California, it's this small zip code that actually happens to have a lot of greenhouse gas polluters and oil companies in their backyard. We worked with community partners on identifying this particulate matter that's in wildfire smoke, specifically to understand how the population is being impacted by these companies in their backyard. We wanted to look at a largely Latinx immigrant and low-income population, and we wanted to see what the impact of racism, poverty, and broader effects of this toxic stress does to them. And on the next slide, I'll show you what the outcome was. So Stanford Medicine paired up with community partners, and I think this is super vital to point out because we didn't go into a community getting the information that we needed and left. We formed partnerships with community partners that were already on the ground and worked with them on doing town halls and workshops to assess what people's education levels were in regards to what was in their backyard. And then we took that outcome to the California Air Resources Board and showed them that there was systematic racism when it came to how people were being impacted by asthma rates and hospitalization rates, specifically among the immigrant and Latinx community. And that eventually led to some policy changes, or at least some more transparency about the data that comes out. Here's actually a guide that we started partnering up with the community organizations to ensure happens every month about some of the education that comes out of research studies like this. And I think it's super vital to ensure that research actually gets to this stage. So with that, I want to conclude with some important key takeaways. One, research underscores the critical need for sustainable healthcare, but specifically delivery models that actually ensure quality patient care. Ones that are giving the treatment to the patients, but ones that are also ensuring that they aren't harming the environment. And that's something that we need to push for hospital systems to ensure that they're doing. And we need to also, of course, elevate education on the health vulnerabilities of the climate crisis and ensure that we're supporting youth-driven and community-oriented solutions to address this burden. So thank you so much, and I'm excited to stay with you for the rest of the day and hear about other cool health initiatives that are happening within this space. But yeah, and feel free to reach out to me over email. I'd love to continue the conversation and bring it to systems near you. So thank you.